Cindy. I'm
Hi.
Jen. I'm going to be your nurse today.
Okay.
I'm here to access your implanted port.
Okay.
Okay. First thing we're going to do is we're going to look at the site and make sure there's no signs of infection, any skin breakdown, and it actually looks great.
Okay.
Now, do you prefer to use ice or Emla cream?
They've used both, but I like the Emla cream better.
Okay, so I've actually got some Emla cream from the pharmacy already, so we'll go ahead and put that on there. And what size of Huber needle do you use?
A 19 gauge usually.
A 19 gauge usually. Okay, so I'll go ahead and send a message to CS and get a 19 gauge Huber needle sent up. But first of all, let's get the Emla cream on there and get things numbed up because it'll take about a half an hour to an hour to really get to be effective.
Okay, sounds good.
And now this is a sterile procedure, but first we'll go ahead and do the Emla cream. I have my gauze here, my Emla cream, and we're just going to put a nice thick layer on there and cover the area, okay? Okay then, I'm going to let that rest on there and get it working and go get the supplies I need, okay?
Okay, sounds good.
Using a sterile gauze, remove the Emla cream prior to inserting the Huber needle into the port. After you have opened your sterile supplies and donned your sterile gloves, clamp the clamps on the extension tubing of the Huber needle. Cleanse the area with chlorhexidine in an upward and downward motion for 30 seconds, and then allow the area to dry for an additional 30 seconds. For the purpose of this video, we will not allow for proper drying time. With your non-dominant hand, palpate the area locating the center of the port. Insert the Huber needle perpendicular to the port septum or to the center of the port. Push the needle through the skin into the septum until you have reached the bottom of the reservoir. You will meet resistance. Now you will check the placement of the needle by aspirating for return blood using a 10 milliliter syringe. If you are unable to aspirate blood, first reposition the patient by having them turn on their side, sit up, or elevate their arm on the port side over their head. Be sure that all the clamps on the catheter tubing are unclamped. If you are still unable to establish a positive blood return, immediately remove the needle and repeat the procedure with a new needle and sterile supplies. After you have a positive blood return, it is time to secure the Huber needle to the patient's chest. Take the foam disc provided to you in the Huber needle package and slide it between the patient's skin and the Huber needle. Next, place a large tegaderm over top of the area, leaving the tail of the Huber needle out of the dressing. Make sure that the Huber needle and the port is completely covered. Label the dressing with the time, the date, the gauge of the needle used, and who inserted it. Just like an IV, a Huber needle needs to be changed every 96 hours and flushed every 8. Okay, Cindy, your Huber needle is in. Now I'm going to flush it to ensure that it's patent. Now you let me know if you experience any pain or discomfort while I flush your port. As you are flushing the port with 10 milliliters of preservative-free normal saline solution, it is important to look for any swelling or any pain that the patient reports at the site. If you do have swelling or pain, remove the Huber needle immediately and notify the physician.
How does that feel, Cindy?
Feels good. It's
Okay.
not sore at all.
So now we are going to be flushing this every 8 hours, and every shift as well. We're going to be inspecting the site to make sure there's no infection. But you let us know if it starts hurting at all, okay? If there is, we'll have to deaccess it and call the doctor, okay?
Okay.
And this is just like an IV. So what we'll do is it's in for 96 hours, and then we have to re-access it at that point, okay?
Yep.
Great then. Any more questions?
Nope, I think that's it.
All right then.
Thanks.